Health Minister Korle-Bu Menu also informed MPs government is backing Korle-Bu Teaching Hospital to renegotiate its contract with a South African consumable supplier, which has monopoly for the supply of the consumables.
The Korle-Bu Teaching Hospital, in consultation with the Minister of Health, has initiated discussions with FMC for review of the current contract for more flexible payment options and a more structured supply of consumables to avoid excessive delays and to ensure delivery of the outstanding 45 dialysis machines and auxiliary equipment to boost the service being rendered. Mr. Speaker, in the meantime, the RDU has been opened to the public since Monday, 6 November 2023, to add patients as directed by the ministry. The MOH has since made a request to the Ministry of Finance to settle the total indebtedness of the 4 million Ghana cedis. And the good news now is that the Minister for Finance has just approved the disbursement of this 4 million to support our patients in Korle-Bu.
Well, NDC MPs were not excited about government's handling of the whole situation.
The problem at Korle-Bu Teaching Hospital, I see it as leadership failure. I see it as government not being responsible for the health of the people of this country.
MP for Asawase Muntaka Mubarak does not believe Korle-Bu has justified its proposed hike of the price for dialysis treatment.
If you take, for example, the fees and charges that we gave, 380, yes, over the period, there may be some challenges, what we call exchange rate difficulties, but Konfanoche is operating with the same 380, and they've not closed the unit. Yes, I'll agree, Konfanoche has, I think, about 10 machines, but largely you go and you have between 2 to 8 that are working at a time. But Konfanoche is operating with that. If you go to Brekum, where you have the Catholic hospital, even though this house gave a fees and charges of 380, Mr. Speaker, they are charging 350. They are charging 350, and they are able to operate. Now you come to Korle-Bu, where it is the state that is paying for the specialists, the state that is having the, what do you call the infrastructure, and all the nurses and all of that. They are making us believe that the only way Korle-Bu unit can operate is to charge up to about 900. Mr. Speaker, I'm happy the minister himself acknowledged that that contract with FMC needs to, they are looking at it. That is where the problem of Korle-Bu starts.
There is now calls from within government for the finance minister to stop capping funds belonging to the NHIS.
The kidney failure, the liver failures, even some diseases, every country controls its own destiny, so to speak. So let's have a national conversation, look at the funding of health insurance, and the finance minister has no business capping, what do you call it, the NHIS, because it's unconscionable.
Renal patients, some of whom were in parliament, reacted to the minister's address.
We thank God that the 4 million will be released by the Minister of Finance to pay that debt Korle-Bu was owing. That created a lot of problem for us that the unit was closed down on May 22nd this year.
I didn't hear or see any, policy direction talking about tax waivers or what government or authorities are doing to make sure we have a lot of the machines in the system.
At least 19 persons died within the period that the Korle-Bu Teaching Hospital closed the OPD of its renal unit. Now that has been opened and government is paying the 4 million Ghana cedis that it owed the suppliers of consumables to the facility. The renal patients are asking government to do all it can to end the debt. They are also asking government to consider putting treatment for kidney diseases on the National Health Insurance Scheme. And as you've heard, it has come up strongly on the floor with MPs asking the finance minister to stop the capping of the NHIS funds to allow NHIS get enough money to be able to move in and assist these patients. Reporting for Joy News, Kweku Asante, Parliament House, Accra.